Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Centre, Pune. Today I am going to talk to you about an important subject in test tube baby. Why does IVF fail? Now, whenever we hear of failures, it's always a very sad thing, but it is very important to learn from your failures, and hence it is very important to identify why did it fail in the first aspect, and it's very important to verify, analyze, cross-check every step of the previous IVF cycles to be able to know exactly what was the reason for the IVF failure. Now we know that IVF is nothing but the seed and the soil, correct? So seed is nothing but whatever embryo we transplant in the mother, and soil is the mother's uterus. So if we look at the uterus, we can evaluate the uterus with various techniques like the sonography or hysteroscopy is a technique in which we can actually go and see inside the uterus with the help of a hysteroscope and to find out whether there is any problem why the baby cannot attach to the uterus. Apart from this, the most recent advance, that is the ERA testing, which will tell us whether genetically there is any problem with the endometrium because of which the baby is not hatching to the uterus. Apart from this uterus aspect, let's come to the seed, that is the embryo. Now we know that embryo has two parts, the male and the female part. So the female part, that is the mother's side, we need to evaluate the egg quality, the egg quantity, and the male part, we need to evaluate the sperm morphology, quality, type of the sperms, and DNA fragmentation of the sperms, etc. So all in all, if the quality of the embryo is absolutely great and if your endometrium is fine, then only there are very high chances of a IVF success. So whenever your IVF fails, it's time for introspection. We need to figure out where things are not up to the mark, work on them before we take the patient up for the next IVF cycle. Thank you.